morning. Happy Monday, July 18th. Well, let's see what's going on. Last week, unfortunately, we lost the actor James Caan. He came to prominence, as I understand, in the movie The Godfather. You know what? I've never seen Godfather movies. I did see him playing the part of Mississippi with John Wayne in El Dorado. And of course, for us Chicagoans, he played Brian Piccolo in the movie Brian's Song, and that was about the Chicago Bear, Brian Piccolo, who died of cancer, who was buddied up with Gale Sayers. So I've just aged myself. The other thing that's going on is, do you see President Biden has been in the Middle East last week on a nice little tour? Haven't really paid much attention, other than the fact that he's been gone. And, what I did see was inflation now is officially at 9.1%. It costs the average household $485 per month more this year than it did last year just to maintain itself. Seems like it's going back to the 70s and the early 80s. Maybe we need to re-elect Ronald Reagan to get inflation under control. Anyway, let's get to today's topic. A lot of you who've had health insurance for quite a while before the Affordable Care Act will know what the grandfather clause is. You've been grandfathered in. So the grandfather is an exemption that allows people and entities to continue doing what they were doing after the implementation of a new rule or law. The grandfather clause can be permanent or temporary. The grandfather clause can also be referred to as the legacy clause. Another thing is, you're in a situation now where you have two rules that are in place, the old rules and the new rules. The idea is to get people to transition from the old rules to the new rules. So there may be a grace period, which is why the grandfather clause or the legacy clause may be just a temporary situation. Yeah, okay, Mark, blah, 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 whatever. Well, why that's important to me is I've been licensed going back to 1984. I'll be 38 years this fall in this business. Laws, of course, have changed. I am a firm believer that you cannot last 38 years in this business unless you keep up with the changing times. Very simple. When I got into this business, we didn't have the Affordable Care Act. Now we have the Affordable Care Act. I have to be current with that. Every year I have to get certified for Senior Marketplace to sell prescription drugs and Medicare Advantage plans. AHIP is a nationally recognized organization. It stands for America's Health Insurance Plans. And they're the ones that I have to be certified with every year to continue going forth. After certification with AHIP, then I have to be certified with various insurance companies. So here's the thing about AHIP. I'm going to read this because I just can't remember it all. AHIP is committed to driving the innovation needs to create a more equitable, affordable, and sustainable healthcare system that allows every American to access the best possible care and live the healthiest possible life. What's wrong with that? Absolutely nothing. AHIP's vision is health insurance providers working together as one, making healthcare better and coverage more affordable for every American, listening and guiding the conversation on care, advancing medical and physical health, always improving how and where we help others, harnessing the power of collective expertise, turning healthy insights into healthful innovation, all for the greater good so everyone can thrive in good health together. That's what CARE does. That's AHIP's vision. Nothing wrong with that, right? Of course not. I don't have a problem with any of this. My only problem is I don't like the stress of being required to take a test and pass it at least at 90%. That's it. But even though during this time of the year, most people around me will say, Mark, you're a real sourpuss. And they're right, because I don't like doing this. I firmly defend the right to do this. You can't be 38 years in this business unless you do it. Those coming into the business, you cannot last 10, 20, 30 years in this business unless you understand You're going to have to do this. You're going to have to stay current. We all have to have continuing education. I don't care what you do in life. Continuing education is part of it. Okay, so after last week, I've got ready to sell status with the insurance companies that I feel are most important to you, the client, and to me, to allow me to service you. Sometimes you ask me for an insurance company, and I'll tell you no. And the reason I do is because that particular insurance company, I'm just not convinced that they know what they're doing. I don't want to recommend them to you because I'm not convinced that they can be around for the long run. So the companies I represent are the companies that I think are going to give you the best service and help me be the best agent to you as possible. So, hey Mark, what's going on at the MLD Agency? Well, you know, last week we were able to help 2 families out with their home and automobile insurance. And in each case, they were with captive companies, and we were able to save them some serious dollars. And by serious dollars, I am talking about the $1,000+ range. That's some serious money to me. That would take care of my electric and water bill for the entire year. That kind of savings. So that's what's going on. And like I said earlier, we got ourselves certified for the Medicare Advantage prescription drug plans, the dual special needs and the institutional special needs for 2023, and the prescription drug plans. So that's what's going at the MLD Agency. Don't hesitate to give us a call so we can find what's in your best interest. Until next week.